3 News Now Web Extra.
We've had to open multiple units that are dedicated solely to the care of COVID-19 patients. So we've had to move patients that normally would occupy a given unit to different space and then dedicate that unit to COVID-19 patients. So it's very busy. We have more COVID-19 inpatients now than we ever have, and it's far more than what we had in the spring. Capacity is a difficult concept because what all the hospitals are doing is we're trying to figure out every possible space that we can use for patients. So that capacity in that sense, we're increasing it as much as we can, but we are admitting COVID-19 inpatients to Omaha hospitals faster than we are creating new capacity. So we're at a point where we're probably a few weeks away from having hospitals full. I sympathize with Governor Ricketts because he's in a very difficult position. Making decisions like this during a pandemic is extremely difficult, I'm sure. But we do need stronger directed health measures. We, the healthcare workers, are asking the state of Nebraska to please give us stronger directed health measures, including a mandatory mask mandate. What scares me the most is the thought that we will have all of the hospital beds in Omaha and the state of Nebraska filled, and yet we will have more patients that need hospital care. If patients need hospital level care and we don't have beds for them, that's when our death rate will go up very rapidly. The most important thing that people need to do right now is stop being indoors with people from outside of your own household. There's a lot of people that are gathering at parties. People are having other people over for dinner indoors. There's indoor athletics going on. All of these activities are spreading the virus. So the most important way for us to get control of the spread is for people to just stay with their own household and not be indoors with people from outside their household for any non-essential activity. So for example, basketball is not essential. I love basketball and I wish that I could continue to be an assistant coach for my son's team. But basketball is a really easy way to spread the virus. So that's an example. But everybody just needs to go back to the way we were doing it in April, where we stayed home, we didn't get together with other people. And I don't just mean large groups. I mean, we shouldn't be inside houses or buildings with people other than our own household members for non-essential activities. There's a concept that I've heard a lot about of a bubble where multiple different families feel safe getting together because they are convinced that all the members of those other families have been doing a great job with social distancing. This is not the time for that kind of bubble. The bubble right now needs to be our own household, and that's it. Otherwise, we're not going to get this thing under control, and we're going to get to that scenario that we really don't want to. The biggest burden has been on nurses and respiratory therapists. There's a finite number of nurses and respiratory therapists in Omaha and in the state of Nebraska. In most hospital systems right now, nurses are being asked to do mandatory extra shifts. Certainly that's true in our hospital. They've risen to the challenge. They did it in the spring. They're doing it again, but it is taking a toll on them physically and mentally and emotionally. This is really difficult work. And the nurses and respiratory therapists have to wear their PPE basically all day long and take care of extremely sick people. And so what they want, what we want, the physicians, the nurse practitioners, the physician's assistants, nurses and respiratory therapists, and everyone in the hospital, what we want is everybody in Nebraska to recognize how dire of a situation we're in and do everything by the book. It's the only way we get control of this.
What are you guys seeing in your hospital? I know because sometimes it changes. Are you seeing more females or males, or is it a combination of both? And are the people in their 20s or 30s or older individuals?
It's about an even mix of men and women, maybe a little bit skewed towards men. Most of our patients are over the age of 40, but we have had several patients in their 30s who are extremely critically ill. We've had people in their 40s who have died. We have quite a few patients in their 50s, 60s, and 70s. So it does skew towards older people. But I want to emphasize that just because this disease hits older people harder doesn't mean that young people don't need to alter their activities. Young people spread it to each other, and then invariably young people come into contact with older people, parents, grandparents, coworkers. And so when a 20-year-old is asymptomatically spreading the disease because they've been out partying or getting together in large groups, that doesn't help us turn this thing around. We need everyone to be staying at home and not interacting with people from outside their household.
Okay. What's your prediction if things don't turn around quickly here? I know we're at the top 5 in the state so far as COVID-19 cases via population.
If we don't change the trajectory that we are on, we will absolutely have more patients than we have hospital beds for. And so kind of a crystal ball that people could use to see what happens if we don't change our trend is to look at El Paso, Texas, which is currently struggling horribly with a COVID-19 outbreak. Their healthcare system is overwhelmed, and the number of deaths that they are going to see over the next few weeks is going to be terrible. So that will happen if we do not change the trajectory that we are on. We have to change the way people are going about their life. I'm bothered most that this is preventable, that the virus does not have to control our lives. Human beings can be in charge. Human beings can keep the spread of this virus in check. But the only way we can do that is by following the simple guidelines that are out there. And, in June, when things were really lighter, in July, those are times where we could have more interaction with other people, mostly outdoors. But when we get to a point like this, we really need to buckle down and, like I said, stay at home as much as you can, work from home if you can. So that's what bothers me the most, is just that we can prevent this thing from getting worse, but we have to choose to do it. And I understand pandemic fatigue, and I understand that people want this to be over with, but there is no ceiling to how much damage this virus can do. We have to will ourselves out of this predicament. I guess I would just add that this is not just a problem in Omaha or Lincoln, that I hear from healthcare workers all over the state every week that their hospitals are filling up. Some of them are already full, and they're having more and more difficulty transferring patients to the larger hospitals. And I want people to remember that when hospitals are all full, there is no room for heart attack victims, stroke victims, trauma victims, or other major health problems. So imagine what Omaha will look like. Imagine what Nebraska will look like if we don't have hospital beds for patients with those conditions. It's a nightmare situation.
How many beds does your hospital hold currently?
Well, there's the difference between physical beds and staffed beds. I think physical beds, there's something between 700 and 800. But remember that the only bed that's useful is a bed that has nurses to staff it. So I'm really glad that our hospital has hired a lot of new nurses over the last several months. So we've been able to increase the number of staffed beds, but I believe the number of staffed beds we have runs somewhere between 600 and 700.